Good afternoon, everyone. Thank you for joining us at CCDPH's School Health Meeting. I am Kelly Jones. I'm a health educator with Cook County Health Department, and it is so good to be back to see you. I missed you all. Let's get started. Our agenda today is welcome and some housekeeping announcements, resources, and events that you may want to be aware of, a communicable disease update, an update by our Tobacco Prevention and Control Unit, and our Guest Respiratory Health Association will also update you. Let's get started. Our objective for these meetings are to keep you all informed and get the most up-to-date information and guidance to navigate issues related to health and wellness regarding schools, to share resources and access valuable tools and events in our communities, and for support. We're here to connect you with peers and staff, students, and even our CCDPH staff in order to help you navigate your community needs. A little bit of housekeeping. Please make sure your lines are muted. We don't want to interrupt anyone from getting this valuable information. Feel free to put any questions you have in the chat. And as a reminder that all of our webinars are uploaded to CCDPH's YouTube page, as well as CCDPH's website for you to watch later. A few announcements. Yay, I'm back. It's so good to see you all from my extended time off. I missed you all. It's good to be back and see what's going on into the community. And I was also made aware that you guys prefer the recurring meeting portion that we had before for our invites. So they have returned to Eventbrite, and I see you guys have found it. The link is here. And if Stacy could put that in the chat, I'd appreciate it. That would be great, Stacy. And also, in lieu of getting the follow-up email with the slide deck, which as you'll see is pretty expansive and will cause some bounce back from emails, we have now implemented a newsletter that you can sign up for to get information, school-based information. So Stacy will also put that link in the chat as well. Appreciate that, Stacy. Thank you, April. Here is a slide for CCDPH's contact information. If you're not already aware, if you just have some general questions, you can send that to the Healthy Cook email address. If you'd like to report communicable diseases, have any metrics or line list questions, you can send that to the CCDPH_schools email, and someone from communicable disease will follow up, as well as our CCDPH website school specific page, which has information on the webinars and any other school information, as well as information on obtaining allergy and asthma resources. We'll go into that in a second. As you know, I used to be the point person for the request for allergy and asthma prescriptions. Now we have that request located on our website. So you can click the link that is here. And if Stacy could put that link in the chat, that would be great. And you can access that in order to request EpiPens and albuterol prescriptions from CCDPH, as well as standing orders. If your school qualified for the Rescue Illinois program, you will automatically receive that medication and all of your supports directly from Rescue Illinois. If you have any questions, please contact Naomi Soto at Asthma and Allergy Foundation. She is the point person for the Rescue Illinois program. If you do not qualify for the Rescue Illinois program, feel free to reach out to CCDPH regarding those prescription requests. As well as your Narcan requests. Those will come from Denise Holman, whose email address is listed here, as well as the request link for those Narcan. CCDPH has restarted its screening process for vision and hearing for preschool age children only, ages 3 to 5. Application is available on the slide. This has a link. And the screening will include identification, testing, evaluation, and any follow-up services, and provide necessary referrals based on evaluation results. CCDPH is sponsoring COVID and flu vaccinations at various Cook County clinics throughout the county. The locations are listed on the slide here, and I believe there's one coming up this weekend at Arlington Heights. So we spread them out throughout the community so that everyone can access this information. Another user took control. We're going to take back. I don't know what happened there. Hold on one second. Let's get back. Okay. Can everyone see that okay? You're good? Okay. And just to reiterate, I've been getting requests for mobile vaccination supports and resources. So I created a slide with those mobile vaccination resources and organizations. You can request them on the links that are embedded into the slide. This is the time to start requesting these mobile vaccinations for your summer and back to school events as they book up very quickly. We have some mental health resources. 988 is the suicide crisis line that you can text or call, as well as 211, which is a nationwide resource line. You can text, call, or go online for 211. You could ask for things like, where's my nearest food pantry? I need housing assistance, et cetera, et cetera. And that is nationwide. There's some information on adult mental health training, as well as youth mental health trainings and mental health first aid. There are some community resources that we have gathered, and we miss you so. Stacy has assisted in gathering these resources. They are abundant. So, in the interest of time, I'm not going to individually go through each one. You can go through that when you review the slides, but I just want to highlight a couple, as in this youth ambassador paid internship through our forest preserves. The deadline is next month, so take special note, as well as an empowerment program through Rich Township. So I'll sort of slide through them. There are a lot of resources and youth information and supports. So I'll just quickly click through them all, and you can look at them at your leisure, as well as some grant information when you have the chance. Upcoming community events. Here is the link for a couple food pantries that we have found the information from. We hope that it helps, as well as substance abuse and family supports, and some wellness expos and volunteer teen and health fairs. Now, I would like to welcome Lex to the stage, and she's going to give the communicable disease update. Lex, if you'd like to take control, you can. Otherwise, I will advance your slides.
Hey everybody, I think I should be able to navigate the slides myself. I've
Okay.
got the button to advance. Thanks, Kelly. We've come a long way since the beginning of COVID with these presentations. Um,
Yes.
so hello everybody. I'm an epidemiologist with the Communicable Disease Unit at the Cook County Department of Public Health. I've been doing some of these school health updates since the beginning of COVID-19, and I'm always happy to come back every winter and uh, give it another go. So I'm going to be going over what's going on with respiratory illnesses and then a little bit of GI because it's been a big year for norovirus. So, brief snapshot of where we're at with respiratory season. We seem to have peaked, so we have gotten through the worst of it, but it's still going to be high for a little bit, and that's mostly due to flu. RSV was pretty bad. I'm sure all of you with young kids who teach young kids, take care of them, RSV has been bad, but we've kind of made it through the woods there. COVID's been surprisingly low this whole winter season, but flu's been our biggest factor here, causing illness.
Can I
And we're still.
interrupt you real quick, Lex? I'm
Oh, of
sorry.
course.
I don't think that your slide you were advancing for everyone. So if you aren't able to
Oh,
do it, then I'll advance. You can just tell me next slide. There should be a button up top if you don't see it that says take control. If you don't see it, then I'll just continue to advance your slides. There you go. You got it.
there we go. All right. Sorry about that, folks. Um, so this is my snapshot I was talking about. There's a link to the respiratory app where we have all this information and data and way more that you can toggle through for different age groups. And then we also have a printed report that some people like to get and like put up on their bulletin board or whatever. So if you want that, my email's on the screen. Otherwise, a quick Google of Cook County respiratory health will bring up our dashboard here. But like I said, flu's the biggest antagonist this season. So respiratory hygiene still needs to be supported. You guys know, teach those little ones the proper way to cough. Make sure there's hand sanitizer everywhere and hand washing with soap people actually like to use. Um, clean air as much as possible, good air turnover, making sure there's every opportunity for people to stay home when they're sick. I know my husband's classroom had like a third of kids out last week, so they live streamed one of the lectures there. So trying to keep those sick kids home, not get anybody else sick. And again, it's not too late to get vaccinated. So COVID-19, like I said, not much of a worry this season, which is really great. Admissions have been low for the ICU and are mostly happening in older adults. Kids still can certainly get COVID, but the really, really bad cases, the few really bad cases we've seen, have mostly been in older people. And then flu, we are worse than we've been than our last pre-pandemic big flu season that we had, which, if you remember, was 17 to 18. So ER visits are above where they were, hospitalizations are above where they were, ICU admissions are above where they were. Activity is high, but it's pretty stable. And if you look at the graph I've got over there, you can see that dark blue line is where we were last season. So we're well aware where we were last season, and that lighter blue is our last bad season. So you can see we're pretty consistently over those peaks there. And then of the flu specimens that have been tested in labs, we've got mostly H1N1, that strain from back in 2009, but plenty of H3. And we're also starting to see flu B start to rise, and that's pretty typical for this time of year. And the great news is both of this pandemic H1N1 and H3N2 covered in the seasonal flu shot, definitely making people's infections less bad than they could have otherwise been. And then for RSV, we peaked slightly higher than when we first started seeing RSV pop off during the pandemic, but at a different time. So you guys are, I'm sure, exhausted coming off of this RSV peak. But ER visits, hospitalizations, activities generally just starting to decline. It stayed declining for a little bit, which is great. But again, this is impacting mostly younger kids, so that's kind of in your wheelhouses there. And then some other stuff to note about respiratory season. Um, since the pandemic started, we've kind of had this pneumonia du jour of like, what's going to cause weird pneumonia this year? And this year it was mycoplasma. There were several classrooms this year that had outbreaks all across the county of this mycoplasma pneumoniae. But that was, if you remember, back before the new year happened, and we've been going down pretty consistently since then. So that's great. We seem to have made it through the woods with our weird pneumonia this year. And then some others, that more of the common cold variety is that human metapneumovirus and then enterorhinovirus. Um, those are still at low levels. We typically see those start to increase. Um, Maybe not now, but in a few weeks. So those are where we expect them to be, nothing to worry about there. And then perhaps worse than respiratory illnesses, at least to me, GI illness. This has been a terrible year for norovirus. I know you guys know that. You have been on the front lines of one of the grossest illnesses around. Um, we've heard from you guys that there have been outbreaks, so we've got anecdotal evidence. We have outbreak evidence of classrooms that had to be shut down. It's been crazy. And what you're looking at in this graph is what we have from lab tests. So people who have felt sick enough to go to the doctor, get tested, see what's making their stomach so upset. Activity is high. It it kind of decreased for a little bit in January, but popped back up in February. But as you can see, the past two seasons that we had, they weren't so bad compared to this one. This is more than double where we were at in terms of percent positivity from labs. And then if you went back even further during the pandemic, you'd see really low levels just because people were distancing. And the last thing I have to say about norovirus is a reminder that alcohol alone isn't enough to kill it. It is a hardy virus. You need hand washing with that friction to break it down. And then on surfaces, you need bleach solutions, not just alcohol wipes. So if you've got a classroom with a couple kids out, we need bleach cleaning in there. All right, I will stop taking control and turn it back over to Kelly. Thank you guys so much for listening to that.
Thanks, Lex. Good to have you back. If there are any questions for Lex, please put them in the chat and we will make sure that we get those questions answered during our Q&A period, or someone from her team may answer the questions within the chat. We appreciate that, Lex. Thanks. That's some good information. And you can always tell norovirus from a smell. I remember when my son was a little and he had it, and oh boy, you'll never forget that smell. Uh, I'd like to welcome our CCDPH Tobacco and Control Unit, Prevention and Control Unit, to do a presentation on what they have been working on. Welcome, Neela. Would you like to
Th-
take control? Or would
Sure.
you like?
Let's see
Okay.
if this will work for me. Thank you, Kelly. Nice to see you. It's been a while since I've been on this call, as well. So I'll introduce myself. My name is Neela Satyanarayan. I am the Tobacco Prevention and Control Unit Program Coordinator at CCDPH, and wanted to speak today a bit about the program and introduce our partner, Respiratory Health Association, who will talk more about some educational opportunities for schools and parents and school administration and staff. So to start off with, I wanted to just kind of set the stage and talk about, the challenge and the disparities around tobacco use and exposure. And while overall tobacco use is declining, which is great, we know that it still remains the largest preventable cause of disability, disease, and death in the United States. And it's, you know, secondhand smoke causing premature death in 41,000 adults and more than 400 infants each year, and secondhand smoke causing many deaths from lung cancer as well as heart disease. So we know this challenge still exists, even though we see numbers are going down, and the widening disparities and the lower quit ratios across the age groups are still a concern for us. And to touch on, youth and young adults, which has been our focus more recently over the years because of vaping and e-cigarette use. 2.1 million youth and young adults reported using e-cigarettes, and more than 1 in 4 report daily use. So we know that they are using e-cigarettes on a regular basis, and almost 90% are using flavored tobacco products and flavored e-cigarette products. And this also connects to individuals with behavioral health conditions. Nearly 25% of adults have a mental health or substance use condition, and these adults consume almost 40% of all the cigarettes smoked by adults, which can lead to a lot of tobacco, again, a large amount of the tobacco-related deaths. So to put this into perspective, it's still an area that we want to focus on and work on decreasing use and increasing prevention and providing education and quitting resources to the community. So a bit about our program at CCDPH. Our program is grant funded. Each year there are 4 people on our tobacco prevention and control program, myself and 3 other health educators. And our goals and our objectives of the program are to identify and eliminate tobacco-related disparities, eliminate exposure to secondhand smoke, prevent the initiation and the start of using tobacco and nicotine and vaping products among youth and young adults, and promoting quitting amongst those who are currently using. Our program is based on some best practices provided by the CDC to have a comprehensive tobacco prevention and control program. And so we implement a variety of evidence-based strategies, including community interventions, cessation interventions, surveillance and evaluation, leading a tobacco-free coalition, and putting out some mass reach health communications. And I'll dive in briefly on each of these strategies, some of these strategies, to say that, we implement these in complement to each other to see a better outcome when we are doing, education in the community, and as well as providing the cessation resources and helping areas go smoke-free to help prevent secondhand smoke exposure. Some of our program highlights and strategy implementation. So with our community interventions, we like to promote, tobacco-free living policies for a different areas, including parks, having college campuses be smoke-free, and then helping multi-unit housing properties implement or strengthen their smoke-free policies. We also provide technical assistance to municipalities, park districts, like I mentioned, multi-unit housing property owners, community-based health organizations who are trying to have a smoke-free campus, and schools who would like to either strengthen or update their policies, which respiratory health we'll talk about in more depth. Our Tobacco-Free Coalition, CCDPH leads this coalition to help support activity amongst the passing policies at the local and state level. We have a variety of advocacy and coalition partners in the community, including American Lung Association, Respiratory Health Association, American Cancer Society, Tobacco Free Kids, as well as a few of the other health departments in the area. And the coalition helps with collective action when we are able to share information, problem solve, and be able to strategically develop the work that we're doing to move our policies forward. A newer area in our work is integrating cessation classes and resources into behavioral health centers. Like I mentioned before, we know that adults with a mental health or substance use condition use almost 40% of all the cigarettes smoked. And so we know that having these cessation resources improves recovery outcomes, and increases quit success, as well as reduces the risk of smoking-related diseases for groups with higher risk. And so working with both American Lung Association and Respiratory Health Association, they are training behavioral health center staff on their evidence-based cessation programming. We provide technical assistance for these facilities if they want to adapt a tobacco-free, smoke-free policy for their campus, for their facility. And we also can provide a training on what we like to call a brief tobacco screening, as an opening way to discuss quitting and resources that are available to patients when they're first talking to them and doing patient intake. So this is a really important area of work that we are increasing our resources towards, because we know the complement of having these cessation resources in behavioral health centers improves overall outcomes. Another area that I am excited about is our educational campaign about prevention and cessation. Last year, we launched our new campaign, Unfriend Tobacco, Your Lungs, Your Rules. It is a campaign that encourages individuals, especially youth and young adults, to make healthier lifestyle choices and to unfriend tobacco to remove the negative physical, emotional, and social impacts. that using these tobacco and vape products can have on their lives. And it also provides connection to free cessation resources. So this media campaign will be on TikTok, Snapchat, YouTube, and some search engine marketing. It'll be in English on these platforms, but we also have some of these social media creatives translated into other languages that are available on our page on friendtobacco.com. So we are relaunching this campaign in March, late March of this year, and we're really excited about spreading the word on the campaign and having partners being able to utilize those resources on our website. So please reach out if you have any other questions. And if you want any of the resources for your socials. And then the other piece I wanted to briefly talk about before introducing Respiratory Health Association is our newest strategy for our program is providing school vaping prevention education and technical assistance support for schools. We were hearing a lot from both community members and schools and administration the need for education on all levels for parents, students, school staff. And so we are partnering with Respiratory Health Association to provide this to schools and parents and other community members. So I'll let RHA, I think Rachel is on, and I'll let her kind of continue the discussion on both the educational presentations as well as the technical assistance related to the policies. And thank you all.
Thanks, Neela.
Yeah.
Very informative. Here's Neela's contact information on the following slide. And also, those flyers that she showed are also in English and in Spanish for your use. As Neela stated, we want to welcome the Respiratory Health Association. We have Rachel Moore-Kunis and we have Openyemi Adweyongbo, who are here to discuss their organization and how they can help you in the community. If you'd like to take control, you are welcome to. Otherwise, I'd be happy to share your slides. It's up to you.
Thanks, Kelly. I will take control. Also, really great pronunciation on
Thank
the
you. I
names. It's not
tried.
often people can pronounce my last name right. That was like perfect. Okay, so my name is Rachel Moore-Kunis. I am the program director at Respiratory Health Association, and joining me today also is Opeyemi, who is our tobacco program manager, who oversees the day-to-day activities around our vaping education program. So we're going to speak to you a little bit about, why vaping, why focus on vaping, get a little bit into the specifics of our program, and then, like Neela said, talk a little bit about that school policy side of it and what we can do and how we can be a resource for you guys at the school level. So just quickly, if you guys aren't familiar with our organization, our mission is to prevent lung disease, promote clean air, and help people live better lives through education, research, and policy change. So real quick, I just want to touch on, why vaping. So I have two graphs here. On the left-hand side, you can see that traditional cigarette use or combustible cigarette use has rates of use among high school students has declined significantly over the past 10 years, which is great news. That means education, interventions, and policy change have had a significant impact on how many high school students are smoking cigarettes. But tobacco companies need customers, and they know if they get, a person hooked on nicotine and tobacco when they're young, the chances of them being lifelong customers are a lot higher. So they pivoted from traditional cigarettes to e-cigarettes. And e-cigarettes really, gained a lot of popularity among high school students around 2016. I don't know if you've heard of Juul pods, but that's really when they kind of exploded on the scene. So between 2017 and 2023, you can see rates of e-cigarette use among high school students nearly doubled. And so this is why we are focusing on vaping education and why we saw this need, even though traditional cigarette use has decreased pretty significantly. So now I'm going to turn it over to Ope to speak a little bit more about our program specifically.
Thank you, Rachel. And I would also like to say, Kelly, great job on the pronunciation of my name. Most people would not even attempt it, so I appreciate it. My name is Opeyemi Odoingbo, and I am the Tobacco Program Manager here at RHA. So yeah, we're just gonna continue on with the presentation. So here we see what is vaping. So vaping is breathing in aerosol or vapor that contains harmful chemicals from a battery-operated device. This battery-operated device is called an e-cigarette or simply a vape. And it's very similar to smoking a traditional cigarette. Next slide. So, like I just mentioned in the previous slide, they are battery-powered devices. They are designed to deliver nicotine or other substances to the users in the form of an aerosol. They go by different names. They're often called e-cigs. They're called vapes, or Juul, which is a brand name, or they call them some other form of brand name. The point we're trying to emphasize is regardless of the name, it's still an e-cigarette. And as you can see on the slide, they come in a lot of different shapes and sizes. Some look like your regular tobacco products. From the second from the left, that is actually called an e-cig. It was the first e-cigarette. It was called a cigalike because it was made to look like a traditional cigarette. And as you move from left to right, you see their evolutions. Some of them are made to look like pens. The ones in the middle are called mods because they are modifiable. You can adjust the heat settings on them. The issue with those ones are if you turn the heat setting can be turned on too high, and some of them have actually exploded. And if you go all the way to the right, in recent years, they started making them to look like your everyday items. The ones on the right, those are the disposable ones, and they look like USB flash drives. They look like anything but a cigarette, but an e-cigarette. Next slide. So what is in an e-cigarette? So an e-cigarette contains more than 60 different chemicals. They contain nicotine and nicotine salts. They also contain carcinogenic chemicals, heavy metals, and flavorings. And if you look on this image on the right, the e-liquid components, if we focus on the bottom, propylene glycol, for example, when propylene glycol is heated, it turns into formaldehyde, which has been used to preserve dead bodies. And actually, many countries have banned the use of formaldehyde because it's such a strong carcinogen. Next slide. There are some health effects related to vaping. As I mentioned earlier, it delivers nicotine, and nicotine is a highly addictive substance. It's as addictive as heroin, and it harms the brain areas that is in charge of controlling attention, learning, mood, and impulse control. And teens are a lot more vulnerable to being addicted since the brain actually does not fully develop until the age of 25. And nicotine also can increase stress levels. It can also lead to panic attacks, depression, insomnia, fatigue, and e-cigarettes, the effects on the lungs, they've actually been proven to worsen lung health. They can cause an increase in coughing, wheezing. If you have asthma, it can fill up the asthma and it can cause lung irritation. And it also actually, nicotine also harms the heart. By stiffening the arteries, it can raise blood pressure and it can increase the risk of a heart attack. And the long-term health effects are not yet fully known because it's still an ongoing research. Next slide. So here we see e-cigarettes and advertising. So I don't know if you all have ever noticed, but you never really see any ads for cigarettes. And that is because cigarette companies are not allowed to advertise their product. It is illegal for them to do so. But the same rules does not apply for e-cigarettes or vape. They can pretty much advertise wherever they want. And these big tobacco companies, they do a really great job of advertising to young people. E-cigarette ads reach nearly 4 in 5 US middle and high school students. And these big tobacco companies are spending about $1 million per hour. That equates to about 24 million per day and $8.9 billion per year. And they are doing anything they can. They use celebrities, they use social media, young people, images that resonates with students, as you can see on this slide. Um, as you can see on the slide, the advertising that you see here, what does it look like? It looks like it's geared towards younger people. For example, the juice box, it looks like something you would see in a child's lunchbox or something. The sour, it looks like candy. If I was just looking at it, it looks like candy to me. The highlight, that looks like a highlighter. All of this looks like anything but an e-cigarette. So these are just some of the ways that these big tobacco companies are doing their best to recruit younger and younger people. Next slide. So what are we doing about it? So right now we offer a 1-hour presentation for parents and school staff. We offer it virtually, and the great thing about it is it's available not only in English but in Spanish as well. Next slide. And this is just a brief overview of the topics that we cover. We cover what's in an e-cigarette. We cover signs of addiction. We go more in depth into some of the big tobacco tactics. We cover how to know if a student or a child is vaping. We discuss how to talk to a student about vaping, and we also provide and share quick resources. Next slide. And we also have a vaping material. So some of our vaping materials include vaping information and resources that are geared specifically for parents. So we have a parent information, we have information for school staff, and we have information geared for students as well. And this was developed with grant support from CDPH. And
Thanks,
now I am going to pass it back to Rachel to go over policy.
Awesome. Thanks, Ope. So yeah, that's just a brief overview of the program. And now just touching on a little bit about vaping policy. I'm not sure if you are aware or not, but in 2021, the Illinois General Assembly amended House Bill 3202 to require that e-cigarettes and other vapor devices be included in comprehensive health education programs. However, there were no specific funds to support that. So that is where our organization has stepped in to provide that education. But it is technically required at the school level to include it in your health education programs. So how RHA can help you at the school, from a policy standpoint, RHA can work with you to develop or strengthen your existing policies around vaping. If your school already has a policy in place, we can help review the language to ensure it's up to date, and includes everything that it needs to. Because one of the things is these tobacco companies are really good at adapting to policies and laws, and so things are constantly changing. So just making sure that your school policies have the most updated language. And then, if your policy does not explicitly include anything related to e-cigarettes or vaping in its definition of smoking, we can help update that language again to reflect the current vaping trends and regulations. Another thing we can help you with is coming up with a policy on how to dispose of vaping devices. So vaping devices are considered a hazardous material. Both the lithium battery and nicotine are toxic, so they can't just be thrown in the trash. We also don't want them given back to parents. We want you at the school level to have the knowledge and resources to be able to dispose of these vapes if they're confiscated properly. And so we can provide resources on how to do that effectively. And then, also kind of looking at a supportive approach if a student is caught vaping. And, we recommend non-punitive measures because nicotine is a very addictive substance. Research has shown that punitive measures such as suspension, doesn't help a student quit. It doesn't address the root cause. So instead, we encourage more of a supportive approach. So, some other alternatives we can help you kind of work through are, one-on-one conversations with designated staff to discuss, why the student was vaping, the harms of vaping, next steps, helping a student enroll in some form of alternative to suspension program that's focused more on education and cessation support. There are quite a few online programs that are available for students. And then, having some kind of meeting with the student, their caregivers, and kind of helping to determine appropriate intervention. So that's just a brief overview of how we can help you at the school level, kind of more with the policy side. And then I do want to mention that CCDPH has created an interest form. So if you're interested in learning more about the program, or if you'd like to have our staff come and speak to staff and parents at your school, I believe Neela put it in the chat, so you can fill that form out and we can get in contact with you through that. So other than that, I think that is everything.
Thank you so much. That was extremely interesting and great information. There are a few questions in the chat. Some have been answered, but I'll just reread them for those who weren't in the chat. Lex asked, is there any connection with those nicotine pouches like Zen and vaping? Like, does Zen lead to vaping or vaping to Zen? Rachel's response is there's not enough specific research yet, but dual use of tobacco products is very common among students who use e-cigarettes. Neela put the link to the form in the chat to request their support. And also there's another response. Our school board is considering getting vape detectors for the bathrooms. Is that a thing now? And they work well. They had them at my son's high school. Yes, they do work. I'll let Rachel or Opie answer that if they like.
Yeah, that would be my answer as well.
Yeah. Another question, can certain types of vapes be opened or altered? Would there be concerns that a vape could contain lethal drugs versus just nicotine or the THC inside?
That's a good question. Yes, they can be altered. And there are, one of the reasons why we do speak to youth about this is because there kind of is like a black market for vapes. So some students are getting vapes that are modified or made, at someone's house. So they're not even bought at the store. And so that's where, I don't know if you guys remember the popcorn lung. There were a couple of cases in Illinois of young people who were having holes in their lungs, basically from vaping THC, and a lot of that came from homemade or kind of off-market devices that were modified and contained vitamin E, which causes the popcorn lung. So I have not heard of other drugs being added to vapes, but that is something that we absolutely would keep our eye on. But I think more the concern is, getting vapes are bad buying them at the store, but it's even worse getting them from, secondhand from someone who maybe has tried to make them at home.
I don't know if it was mentioned in the presentation, but is it also a fact that the effects from vaping happen quicker than the effects of just smoking cigarettes on your body?
That, I don't think it happens quicker. However, the amount of nicotine that is in vapes can be higher than traditional cigarettes. So, for example, I think a traditional pack of cigarettes has about 20 to 23 grams of nicotine, whereas a Juul pod can have up to 59. So that's more than 2 packs of cigarettes in one Juul pod. And it's unregulated. There's no limit to how much nicotine currently can be used in an e-cigarette device. So in that sense, students can be ingesting a lot more nicotine using vape devices than traditional cigarettes.
And in addition to what Rachel said, e-cigarettes now, these companies use nicotine salts. And nicotine salts, compared to the free-base nicotine that's in regular cigarettes, they are less harsh on the throat. So they're easier to consume, and it's easier to consume a lot more nicotine due to the fact that it's not as harsh on the throat as a free-base nicotine.
Wow. Another question just came in the chat. If a student vapes while at school and considers it and considering it's nearly impossible to know what substances they vaped, when should emergency care be considered? Great question.
Yeah, I think that's a great question. And I think it's situation specific. When you don't know, I don't think emergency care is necessary unless a student is exhibiting signs and symptoms of needing care. So are they really short of breath? Are they vomiting? Are they, very lightheaded or dizzy? So I would say it's kind of a case, situation by situation, but kind of looking out for those physical symptoms would be the way to go.
Okay. There are other questions, as this is extremely interesting. Please feel free to put them in the chat. And I just wanted to bring up a few years ago, I went to a training with the DEA and they were talking about vapes. This was maybe 4 or 5 years ago. So vapes were maybe fairly in its infancy, but they actually showed the products that you could buy to hide vapes, like the straps on your hoodie are hollow and you can attach your vape to it and smoke it that way, or your backpack straps. And they were just showing different ways that vapes can be hidden by students, and parents or school wouldn't be the wiser. A couple more questions. Can you provide more details on how vapes should be disposed? Oh, Rachel put it in the chat. Great resource. Are there any more questions for Rachel, Opie, Neela, or Lex regarding any of our respiratory illnesses that are on the rise? I'll give you guys a few more minutes to put some questions in the chat, but I just wanted to thank everyone for taking the time out of their day. We have a large group, and I am thankful for your support. Glad to have you back. And just remember, we now have a recurring registration that is back on Eventbrite. So feel free to go on to Eventbrite, and the link is in the chat. Stacy put that in the chat earlier, to register for the webinars. Any webinars that you have previously registered for, those have been canceled. We sort of had an error with that Teams and we weren't able to use it. So we had to start all over. And I just want to make sure that everyone is able to attend and register for the webinars. So if there aren't any more questions, I see Kathy's on. Hey, Kathy, it's good to see you. Kathy's a great support for the schools. But I just want to thank everyone again for taking the time out of your day. And oh, Lex said, thank you. This is fascinating. She's glad she stuck around for the presentation. It really is fascinating. You don't hear much about vaping, and I'm glad that we were able to get more information out. And Tanya wants to know, where do we find the slides? The recording will be uploaded to CCDPH's YouTube page, as well as our website, on our school's website page, as well as the slides will be put out into our new newsletter if you sign up for our newsletter. And again, that link is in the chat and you can access that as well. I'll leave the the webinar open for a little bit so you can access those chats to the Eventbrite, as well as to sign up for our newsletter so you can get all of that information so that you can expect to get that information continuously. We've become such a large group that emailing those slides out has become impossible because they bounce back. So we have to find other ways to get you guys that information, and it is now on our website. So I want to thank everyone for all that you are doing. Thank you for your support. We will see you next month. Feel free to reach out to any of us with any questions or concerns, and enjoy your weekend and be well. Take care. Thank you all. Have a good afternoon.
Thanks, you too.
Thank you.
Thank you all.
Thanks,